Hi, my name's Denise Dillon. I am Head of Product and Engineering for the Access Elemental product. So Elemental is a social prescribing platform, cloud-based platform that connects with lots of different clinical systems as well as secondary care systems such as Rio and Mosaic. The benefits for social prescribing for trusts is that it allows the clinicians to work with the individual for their clinical needs, for example, for mental health trusts, for if it's anxiety or depression, but also then allowing them to refer them into their local communities so that they can benefit from local wellbeing services that may be at the root cause of that person's diagnosis. So someone may be suffering with anxiety and depression when actually the root cause is financial difficulties. It could be housing support that's needed. And so it allows the clinician to not only treat them medically, but to connect them into those local wellbeing services to improve their health and wellbeing. So when using Elemental, there's a wide range of community and wellbeing services that can be referred into. It depends on the community, it depends on the area. It can be something as simple as a walking club for someone who wants to get out, get a bit fitter, meet some new people. It could be diet and nutrition for someone that's maybe at the pre-diabetic stage. It can be financial support, it can be housing support, it can be probably the list is endless, but basically it's just anything that's going to help get that person more engaged in their community. It's going to increase their mental health and well-being, whatever the issue it is that they're facing, and it's something that they wouldn't get from going and seeing a clinician alone. It's something that kind of it's a lifestyle for lots of people. So lots of the programs and services that they're being referred to will improve health and well-being, and that will be long-standing for them. One of the challenges for trusts is that when their clinicians are working with an individual, when they can see that that individual actually has a non-clinical need and would benefit from being connected up to mental health and wellbeing services within the community, it's taken their time traditionally to go and find those services, to try and find out who they are, if it's a good service, and then manually refer that person to the service. Whereas when they have Elemental in place, it's a very secure way to be able to one-click referral, to have the information pre-populated from the Rio system, to complete that referral form and send that directly into the community. And one of the added benefits from that is then that these trusts may be actually funding and commissioning those programs and services, those wellbeing services, and actually they can see the data then within Elemental that will prove that it's actually having an impact and improving the person's health and wellbeing. So the main benefit of Elemental is that it's a digital platform that's able to connect directly with Rio and then also directly with those local wellbeing and community support services. So the clinicians that are using the Elemental system save time when they're there's a few ways that they save time. So first of all, when they're making a referral, if they decide that that person needs to be referred into a community and wellbeing service, the referral form's pre-populated, so they don't have to go finding another form, completing it. It's just there within a few clicks within the Rio system. So clinicians gain peace of mind by using Elemental also, as they know that if they decide that that person maybe doesn't need clinical support, but actually they don't want to just tell them that's it, go home. What they can do is they can actually refer them on to local wellbeing community services, and those services might be ones that they have actually commissioned themselves or that they know of in the community and that are added to the local directory service. So what they have is they have the peace of mind of making that safe, secure referral, knowing that it will be picked up and being able to track that referral and see, has the person engaged, have they taken any wellbeing monitoring tools, have they increased their health and wellbeing? So they have ways to track that individual as well, to give them peace of mind. The feedback from trusts also is that it's a way for them to keep all their data in the one place. So they're commissioning services in the community, but because they're using Elemental, they can say, okay, so we want you to use this particular tool, we want you to have these particular KPIs, and all of that data can feed back into Elemental, and this can then show in time a return on investment for those programs and services that have been commissioned. Another big benefit that the trusts have fed back to us is that it allows clinicians to focus their time on clinical care. So when someone comes into them, they're not having to spend half an hour to find that local walking group or that local swimming group or whatever it may be. So it allows them to concentrate their time on clinical needs but know and also be reassured that that person is also going to be looked after in the community via that referral. So the benefit of the integration with Rio is that it allows the clinicians to make that safe and secure referral within a few clicks. Elemental platform will open up within Rio, so the clinician doesn't need to leave the Rio system. The referral form is pre-populated, so it takes literally a few minutes, and that clinician then knows that rather than going and spending 20 minutes up to half an hour looking for local community and wellbeing services, that they can find them on there, or they can refer them into someone who can find them on their behalf. So some of the feedback from the trusts have been that the integration with Access Elemental and Rio has actually been game-changing, and the reason being is that it allows the clinician to focus on their clinical care so that they're delivering the highest level of clinical care, but also knowing that that individual's social and wellbeing needs are being met. So Access Elemental really helps with patient-centred care in that it allows them to look at the patient as a whole. So not just looking at the clinical needs, but looking at community and wellbeing needs. So being able to refer them into services that are going to have a positive impact on their mental health and wellbeing. So when it comes to waiting lists, we know that waiting lists could be anything from a few weeks to a few months, and in some cases, maybe up to a year. So what the Elemental platform does is allows that person to be connected into local wellbeing and community services that will improve their mental health and wellbeing while they're on that waiting list. There's a possibility someone may be waiting for counselling, someone may be waiting for a specific service, and in the meantime their mental health and wellbeing could be declining, but that could be prevented by connecting them into local community and wellbeing services. Another benefit of Elemental is when a clinician is working with an individual and maybe they're getting to the end of their care, so it's that step down care, or maybe it's while they're treating that individual that they can actually see that they would really be impacted positively by being referred to local wellbeing services. So in that sense, Elemental is crucial for that individual to receive the care and support that is needed at the time. So Elemental can actually help prevent further decrease or decline in mental health and wellbeing, and it does this by obviously the person has been referred in to the mental health trust, and the clinician has been working with them, and what it does is it gives them that support after that gets them more engaged, for example, into their community. It can have positive outcomes by being referred into their community rather than the support with the clinician finishing and then them having nowhere to turn to. So what we've found and what we've heard from our customers over a number of years is that that type of intervention allows someone to keep well and to keep engaging in the community. Commission particular services in an area, and traditionally they would have had to spend a lot of time training up these community and wellbeing services to use the Rio system, and also provide them with smart cards. There was a lot of training that went into it, whereas when using the Elemental system, this is a system that is a non-clinical system, so it's based and it's for community services, so it's a lot easier to use. But not only that, when the commission services are using that system, they then can report back to the trust, so the trust can see how many people are attending, how many referrals are coming in. If those people are attending, they can determine what monitoring tools they would like the commission services to use, like the ONS score or the SWEM webs, whatever it is. And once that data is there, they can actually prove then that these programs and services are working, because the people who are coming through the programs and services are actually showing an increase in their mental health or wellbeing. The future's bright for Access Elemental with the introduction of Access Evo. So Access Evo is going to transform workflows and increase capacity by eliminating day-to-day mundane admin tasks and being able to provide information at the user's fingertips. So whoever you are as a user, we're going to improve your workflow. I'll give you just an example. If your clinician at the trust has sent a referral to a local community and wellbeing service, that person will log into Elemental and they will know exactly what they need to do that day. So a referral has come in, they will be notified, but they will have a feed now, and that feed will show them, for example, if they have an appointment that day, what's their up and coming appointment. And rather than having to go through and search for that individual and search for the case to find a bit of information about them before the appointment, they can simply type into Copilot, give me an overview of my client's case. So those are the types of things that are going to speed up and increase capacity for individuals working within the community and wellbeing services. So the benefit of Access Evo for clinicians will be, there's lots of benefits that they will have, lots of information at their fingertips. So we will have all of the data stored on that individual, and also looking at the individual's cohort, so they're able to see how their services that they've been commissioning in the community are having a real impact on individuals, but also people as a whole. So maybe zoning into certain areas, zoning in on people who maybe have been referred for a specific thing. So allowing them to kind of manipulate and really deep dive into the data and see the impact that it's having. So the AI-enabled tools, for example, at the minute, ChatGPT, you can go on ChatGPT, you can ask it anything, but it's not really that safe, it's not really that secure. You wouldn't want to be putting any personal identifiable information into ChatGPT. But when you're using Access Evo and when you're using Copilot, you can be assured that your data and the patient data is secure. So the data that you're querying is only on the data that we're currently capturing, and it's not going anywhere else. So for example, as a clinician, I can safely go in and ask information on one specific person, or I can actually ask as a whole. I can say, okay, so at this cohort of people, how have people been improving their health and well-being over the last 3 months as opposed to the last 6 months? So that's the kind of data that we have, so we're able to query, and again, that data is all safe and secure.